About 2 years ago, a 54-year-old woman walked into my office. I'm going to call her Dona Marta. She sat down in the chair, looked at me and said, "Doctor, I came here because my neighbor insisted. I don't think I have anything, but she kept bothering me so much that I came just to prove that everything is fine." I smiled, ordered some routine tests and told her to come back in a week. When Dona Marta returned with the results, her smile had disappeared, and so had mine. Her kidneys were functioning at less than half their capacity. Less than half. Do you know what's most frightening? She didn't feel any pain, none. She had signs. Yes, her body was screaming for help, but she didn't know how to read those signs. And that's exactly why I'm recording this video today, because what happened to Dona Marta happens to thousands of people every single day. The kidneys slowly lose strength. They gradually become diseased, and the person feels nothing until one day. When they finally discover it, they've already lost a part that they will never get back. So I need you to pay very close attention to what I'm about to tell you in the next few minutes, because I'm going to show you 5 signs, 5 warnings that your body gives you when your kidneys are in danger. Some of these signs are so common, so part of everyday life, that you'll probably be shocked when you realize you felt some of them and never gave them any importance. Stay with me until the end. This video can change your life, and I'm not exaggerating. It can literally change your life. Before getting into the 5 signs, I need to explain something that very few people know. When I say very few people, I mean it. Most of the people I see in my office have no idea about this. The kidneys are 2 organs about the size of your fist, located herein your back, one on each side. And their main job is to filter your blood. Think of it this way. Imagine your body is a house. Your blood is the water that flows through that entire house, and your kidneys are the filter. That filter cleans the water, removes impurities, takes out what's not useful, and sends it out through urine. Now imagine what happens when that filter starts to get clogged. The water starts to become dirty, impurities build up, and the entire house begins to have problems. That is exactly what happens in your body when your kidneys start to fail. But there's one detail that makes everything much more dangerous. Kidneys don't hurt, at least not at the beginning, unlike the stomach, which hurts when something is wrong, or a tooth that throbs when it's inflamed. The kidneys suffer in silence. They slowly lose their ability to filter blood without giving any signal of pain. And when the pain finally appears, it's usually too late. That's why kidney disease is called the silent disease. It progresses underneath, quietly. And by the time you realize it, it has already taken a good part of your health. And that's exactly why I need to ask you something right now. If this information already made sense to you, if you're already thinking about someone in your family who needs to hear this, then click the like button below. That simple gesture helps this video reach more people who need this information. And if you're not subscribed to the channel yet, subscribe now and turn on the notification bell, because here I bring content that can truly save your health. It's not an exaggeration, it's life-saving information. Agreed. So, let's move on to the first sign. The first sign that your kidneys may be in danger appears in a place you visit every day, but rarely pay attention to: the bathroom. More specifically, your urine. I know no one likes to talk about this, but I need you to start paying attention to your urine from today on, because it is one of the biggest indicators of your kidney health. And there are some changes that are real cries for help. The first is the color. Healthy urine has a light yellow color, like a very soft chamomile tea. If your urine is consistently very dark, like a strong coffee, that may be a sign that your kidneys are having difficulty filtering properly. And if your urine has a reddish, pinkish, or brownish color, pay very close attention, because that may mean there is blood in your urine. And blood in the urine is a serious sign that needs immediate investigation. The second is foam. Have you noticed if your urine is foamy? I'm not talking about that little bit of foam that appears when the stream hits the water with force. I'm talking about persistent foam that stays there for several minutes, looking like soap foam or beaten egg whites. That foam may indicate that there is protein in your urine, and protein in the urine is a classic sign that the kidneys are not doing their job as they should. It's as if the filter is so damaged that it starts letting things pass through that shouldn't. And the third is frequency. If you're going to the bathroom much more often than normal, especially at night, waking up 2, 3, 4 times to urinate, that deserves attention. Or the opposite, if you notice that you're urinating much less than usual, that is also a warning sign. I had a patient who came to me for exactly this reason. He was 48 years old, worked as a truck driver, and told me he was waking up every night about 3 or 4 times to go to the bathroom. He thought it was because of age, that it was normal. It wasn't. His kidneys were already compromised. So from today on, before you flush, take a look. Observe the color, check for foam, and pay attention to the frequency. Your body is sending you messages through it. Now let's move on to the second sign, and this is one that confuses many people. I'm talking about swelling, but not just any swelling. Pay attention. When the kidneys are not functioning properly, they lose the ability to eliminate excess fluid from the body, and that fluid starts to accumulate and appears in very specific places. The first place where you will notice it is in your feet and ankles. You take off your shoes at the end of the day and notice that your foot is swollen, that the mark of your sock or sandal is left behind. Many people think that this is normal, that it's just fatigue, that it's because they stood for a long time, and sometimes it is, but when that swelling begins to, when it starts to happen frequently, when it doesn't go away after a night of rest, that is a warning sign. The second place is the face, mainly around the eyes. You wake up in the morning, look in the mirror, and notice that your eyes are swollen as if you had cried all night. That may be excess fluid that the kidneys were not able to eliminate during the night. And there is a simple way to test if swelling in the legs is concerning. Press your shin with your finger using firm pressure for about 5 seconds, then release. If a dent remains that takes time to return to normal, that may be a sign that the body is retaining fluid because of the kidneys. I remember a patient who came to see me because she thought she was gaining weight. She told me that in 2 months she had gained 6 kilograms, but she hadn't changed anything in her diet. When we investigated, it wasn't fat, it was fluid. Her kidneys were retaining fluid throughout her body. So if you are noticing swelling that doesn't make sense, that appears without an apparent reason, mainly in the feet, legs, and face, don't ignore it. That is your body asking for help. Tell me here in the comments, have you already noticed this kind of swelling? Write down below, I've noticed it, or I've never noticed it. I read all the comments and I will respond to you. Let's move on to the third sign, and this is perhaps the most deceptive of all, because it is a symptom we attribute to everything except the kidneys. I'm talking about a tiredness that doesn't go away, a deep fatigue that doesn't improve even after a good night's sleep. You sleep 8 hours and wake up as if you hadn't slept at all. You do simple daily activities and already feel exhausted. And then you think it must be stress, it must be the hustle, it must be age. But there is an explanation that almost no one considers. When the kidneys are failing, they lose the ability to produce a substance that helps the body make red blood cells. And those cells are the ones that carry oxygen to all your organs, to all your muscles. So when the kidneys fail, the body produces fewer of those cells, less oxygen reaches your tissues, and the result is that brutal fatigue. It's as if your body were trying to function with half the fuel. Imagine a car trying to run with the tank almost empty. Yes, it moves forward, but without strength, without energy failing. That's what happens to your body, and there's more. That fatigue comes along with other symptoms that we don't even connect. Difficulty concentrating, reasoning, remembering things. A constant feeling of cold, even when it's hot. Shortness of breath when doing simple things like climbing stairs or walking to the door. All of that can be linked to the kidneys, and people suffer with this for months, sometimes for years, taking vitamins, taking energy drinks, thinking they lack iron when the real problem is there in the kidneys, silent, getting worse with each passing day. I usually tell my patients, when fatigue is greater than what your routine justifies, something is wrong and the kidneys need to be on the list of suspects. And now I need to talk to you about the fourth sign, and this is the one that surprises people the most. It's the sign that, when I mention it in the office, the person opens their eyes wide and says, "Doctor, I've had that for a long time and I never imagined it could be the kidneys." I'm talking about a persistent itch in the skin, an itch that has no apparent cause. It's not an allergy. It's not dry skin from the weather. It's not a reaction to soap or clothing. It's an itch that comes from within, that bothers you all day, that sometimes wakes you up at night, and that doesn't improve with moisturizer or allergy medication. Do you know why this happens? When the kidneys are not filtering the blood as they should, Toxins, the impurities that should leave the body through urine, remain circulating in the blood. And those toxins accumulate under the skin, and the body's reaction is to scratch. It's as if your body were trying to get rid of it however it can. Along with the itch, there is often very dry, rough skin that flakes easily in a different tone in the skin, a kind of grayish or yellowish color that is not normal. I treated a 62-year-old man who had gone to 3 dermatologists because of itching all over his body. He took antihistamines, used ointments, changed soap, changed sheets, nothing worked. When he finally had kidney tests done, he discovered he already had a significant loss of function. The itching was his body crying for help, and no one was listening. So if you have itching in your body that doesn't go away, that has no clear explanation, please don't ignore it. Go to a doctor and ask them to investigate your kidneys. It could be the missing piece of the puzzle. And now, let's move on to the 5th and final sign. And this one closes the picture in a way that will surprise you, because this sign appears in a place you would never connect with the kidneys, your mouth. More specifically, a metallic taste in your mouth, as if you were sucking on a coin. A strange metallic taste that appears out of nowhere and doesn't go away. And along with that taste comes a loss of appetite. Food loses its flavor. The dish you love to eat suddenly seems bland, tasteless. Sometimes it even makes you feel nauseous, and many people start losing weight because of this, simply because they can't eat properly. Do you know why this happens? When the kidneys don't filter the blood as they should, a substance called urea starts to build up in the body, and that excess urea reaches the saliva, alters your sense of taste, and creates that horrible metallic taste in your mouth. It's as if the waste that should leave through urine starts coming out through other pathways, and the mouth is one of them. And some people even notice a different breath. A strong breath with a smell that resembles ammonia, that doesn't improve with brushing your teeth or using mouthwash. Because the problem isn't in the mouth, the problem is in the kidneys. I had a patient who came to me thinking she had stomach problems. She told me she couldn't eat, that everything tasted bad, and that she was losing weight without trying. The general doctor ordered an endoscopy, abdominal ultrasound, liver tests, everything was normal. When someone finally ordered kidney tests, that's when the answer appeared. Her kidneys were crying for help, and the first place that cry showed up was in her mouth. Now answer me here in the comments. Out of the 5 signs I showed you, how many of them have you already felt or are feeling now? Write the number below. It can be 0, it can be 1, it can be 5. I want to know. And if you know someone in your family, a father, a mother, a grandfather, grandmother, a friend who is feeling any of these things, please share this video with that person right now. It could be the push they needed to go to the doctor. Now I need to talk to you about the most important part of this entire video, because it's useless for me to show you the signs if I don't show you what to do. And the good news is that in most cases, you can protect your kidneys with simple actions that you can start today. The first is water. It sounds too simple, I know, but most people don't drink enough water, and water is the fuel for your kidneys. It's what helps the kidneys do the job of filtering the blood. Without enough water, it's like asking a filter to work. Dry it will wear out much faster. The general recommendation is to drink around 2 liters a day, but that varies from person to person. Talk to your doctor about the ideal amount for you. The second is taking care of your diet, and here I need to be direct. Excess salt is one of the worst enemies of your kidneys. Salt makes the body retain fluid, raises blood pressure, and overloads the kidneys. That processed seasoning, that instant soup, that processed meat full of sodium, all of that wears down your kidneys over the years. You don't need to eliminate everything at once, but you do need to start reducing. Replacing processed seasoning with natural ones, garlic, onion, fresh herbs already makes a huge difference. The third is controlling blood pressure and blood sugar. These 2 conditions, high blood pressure and high blood sugar, are the 2 biggest causes of kidney problems worldwide. If you have high blood pressure or high blood sugar and you are not controlling it well, your kidneys are suffering right now. Take your medications exactly as prescribed, go to your appointments, and do your follow-up tests. This is not something to take lightly. The fourth, and this is essential, is to get regular tests. There are 2 simple tests that show how your kidneys are doing. One is a blood test that measures a substance, indicating whether the kidney filter is working properly. The other is a simple urine test that detects if there is protein where it shouldn't be. These are affordable, quick tests that can detect problems early when something can still be done. Ask your doctor at your next appointment. Say it like this: Doctor, I want to check how my kidneys are doing. It's that simple. And the fifth is to stop self-medicating. I know everyone takes a little pill for a headache here, another for back pain there, but many of those medications we take without thinking, especially anti-inflammatory drugs. The ones everyone uses for PNR, extremely hard on the kidneys. Taking them occasionally with medical guidance is fine, but taking them on your own every week is like hitting your kidneys little by little. Over time, the damage shows up. And now I want to leave you with a message that I consider the most important of everything I've said so far. Do you remember Dona Marta, the one I told you about at the beginning of the video? The one who came to the office just because her neighbor insisted? I have good news to give you, because we detected her problem in time. It wasn't easy. She had to change many things in her life, her diet, her habits, her medications. But today, 2 years later, her kidneys are stable. She didn't need dialysis. She didn't need a transplant. She is living her life normally, and all because someone, in this case her neighbor, cared enough to insist that she go to the doctor. So I want you to be that person for someone. Maybe you yourself are feeling some of these signs and didn't know what they were. Now you do, so don't leave it for later. Schedule an appointment, request the tests, take care of your kidneys while there's still time. And maybe there is someone in your life who needs to hear this. A father who complains of fatigue, a mother who has swollen feet, a friend who mentions that strange itching. Send this video to that person. Share it right now. It could be the information that changes their story. I am Dr. Samuel Herrera, nephrologist, and this channel exists for one reason: to give you quality information that can protect your health. If this video made sense to you, subscribe to the channel, turn on the notification bell, and give it a like. Every like, every subscription helps this video reach more people who need to hear this. And click on this video here on the side because I prepared content that complements everything we talked about today.